So today, in this session, I will share actually my experience mostly about using the safe, fast, and effective technology using the monopolar radio frequency. So before I talk more about the technology itself, maybe I will start with the actually why the skin tightening matters. Of course, this one is one of the underlying problem why we need this kind of modalities. As we get older, our body produce less collagen, both type 1 and type 3 actually decreases by 1% each year, especially after age of 30. This leads to a loss of skin elasticity, which in turn causes wrinkles and skin laxity. Because of these changes, of course, there is an increasing demand for the treatment that are effective, non-invasive, that can rejuvenate our skin. Um, until now, we know that monopolar radiofrequency, as referred to as an MRF, is still remain a gold standard in non-invasive skin tightening treatment. It has been FDA approved since 2006 for treating a facial aging, and its use has expanded to including the rejuvenation not only the face but also neck, abdomen, and also the thigh. This technology works by delivering electromagnetic waves that hit the deeper dermal layer of the skin without causing damage to the surface area. Especially for my skin type, especially, it's really important. And because of it is non-ablative, patient experience minimal downtime. And thanks to its deep penetration, monopolar radiofrequency addresses both skin laxity and wrinkle efficiently. So, let me brief explain how monopolar radio frequency works. So now I start to talk about more to the technology. The device itself send energy through an active electrode, as you can see here in the red arrow. So the device send the energy through an active electrode here, and then which then flow the RF into the body and return to the return pad here that usually we apply at the back of our patient. This current specifically hits the deeper skin layers, which trigger a process known as collagen remodeling and then stimulate the collagen production of and also new elastic fiber within the dermal layer and some even deeper in the skin. Um, Sometimes when we're choosing the radio frequency, we also need to know why we need the monopolar radio frequency. This differentiation on the table here, what I want to underline is the monopolar radio frequency. It's really important choices because it can give the bulk heating in the deeper layer of the skin in the 20 to 25 millimeter depth compared to in the other two of the radio frequency technology. So that's the reason we can treat something that it's deeper. And this showing that the monopolar RF mechanism of action. So when we apply the radio frequency on the skin, it will refer the radio frequency itself into the skin and then continue with the generation of the heat in the tissue. And that happens because there is a current flow through the body and the tissue resistance that it's a part of the body response and then it respond to the electron vibration and then generates heat up to 40 to 60 degrees Celsius. And with this heat, eventually it will create immediate skin tightening, and it showed by immediate it showed by the immediate skin tightening. It because of there is a immediate contraction of the collagen, but its one is immediate. But of course, there is a long-term effect afterwards. There will be process wound healing after 2 to 6 months after that. So we cannot see we're not only seeing the result after the procedure, but we need to be a little bit more to see the long-term effect of this treatment. So where actually the target area of this treatment? This treatment actually target the area where the skin has a lot of collagen in it. So where is that? Of course, number one is the dermis, the dermal area. And then the second one is we call it the underlying fibrous septa area. So this one in the picture, it showed that this fibrous septa area is including the retinacula cutis, that it's giving the area from the dermal layer to the SMAS layer, and then followed by the retaining ligament that it's connecting from the SMAS layer to the deep fascia of the periosteum. So that area is actually the target area of the monopolar radiofrequency. Okay, so what about the efficacy of the monopolar radiofrequency itself? Sin et al. Showing this one in the study. They do the study in the patient. They only do single session of monopolar radiofrequency. We can see here in the picture there is a wrinkle improvement on the patient, but they cannot see it 4 weeks after the treatment, but they can see it 12 weeks after the treatment, and it remained the same after it remains there is an effect after 24 weeks after the treatment. And the second one is the skin firmness. We can this study showing that the skin firmness can be shown as long as the wrinkle, but we can see it 4 weeks after the treatment. It remains there is effect after 24 weeks after the treatment. And this one is made, two of them is measured by the dermatologist, and this one, the last one, is here measured by the patient itself. The patient stated that there is an improvement of the middle and the lower face laxity 4 weeks after the treatment, and it remains after 24 weeks after the treatment. So it really showing that this treatment can give us the long-term efficacy in terms of the wrinkle, skin firmness, and the improvement of the middle and lower face laxity. So along with that table that I've showed before, it's also there study from the histology also showed that there after 2 months of the procedure of the MRF, we can see there's also collagen improvement and also the elastin production after the treatment. And it's not only after 2 months, but we can see also 6 months after that, we still can see there is a better collagen formation compared to the baseline. And of course, we want, as a clinician, we want to see is it really clinically or significantly improvement for the patient. So we can see here in this picture, it was reported after the treatment of the MRF, there is a reduced skin laxity in the jawline of the patient. As you can see here, the picture, we can see there is improvement 2 months after and also the 6 months after the treatment. There is a visible skin tightening along the jawline and under the chin. The sagging or the jaw appearance since before the treatment is noticeably diminished after both 2 and 6 months after the procedure. We can see also smoother skin texture, the fine lines and crepe-like texture along the lower cheek and also neck improve over time, with the skin appearing firmer and more cohesive in the later photos here. And also we can see a better skin contour. The transition between, you can see here the transition between the cheek, jawline, and also the neck become more defined and sculpted. The area below the ear and along the jawline exhibit less dropping, suggesting tissue tightening and mild elevation. Not only the lower face, but also we can see improvement on the around the periorbital area. You can see here there is an improvement on the wrinkle and also the ptosis of the eyelid. So why particular monopolar radiofrequency or MRF superior than the other? If, of course, it's something to do with the technology itself. So here, we know there is so many monopolar radiofrequency out there, but I learned that there's a few specs that we need to know is about how they control the impedance, and then how they can be the cooling can be adjusted, and whether or not we can do the treatment faster than any other devices. So maybe I will start to discuss one by one. So first one about the impedance. So RF and impedance. The first, every part of our skin and body has a unique characteristic. We call it impedance. This means that each area offers a certain resistance to electrical current applied from the outside. So impedance is an essential factor because it influences how much energy is delivered and converted into heat during the RF procedure. Impedance actually varies depending on the type of the tissue and its internal moisture content. If you look at the different layer here, so we can see that we can know that subcutaneous fat has a moisture content it's about 10%. The stratum corneum, which has the outermost layer of the skin, has less than 20%, and the dermis is much higher, between 70 to 80% moisture content. The rule is the lower the moisture content in the tissue, the higher the impedance. So, for example, subcutaneous fat and the stratum corneum both have relatively high impedance compared to the dermis because they contain less water. If you look at the table here, on the right here, you can see how impedance values differ across various body sites. Like in the forehead, zygoma, malar fat, and so on, you'll notice that even within the same patient, this value can vary depending on the anatomical area and measurement level. So there is why very important that we can have the device that can adjust this energy that is delivered depending on the impedance on each area of the skin. Another important point to remember here is that impedance changes with temperature. For every 1 degree Celsius increase in skin temperature, the impedance actually decreases about 2%. This is significant during RF treatment because as the tissue heats up, its resistance drops, which can in turn affect energy delivery and treatment outcomes. And this graph showing that certain devices like the CELLINEW that I use in my practice, it has the auto fit feature, which automatically adjusts the energy output based on the real-time skin check. If the preset energy is too high or too low for the patient's skin, the system bring it into a safe and effective range. This make each treatment safer and more effective for every patient. So it's more personalized, and it's also ensuring that the right amount of energy is delivered for optimal result every time. And the second one is the RF and cooling. Cooling is really essential as part of the RF treatment. By cooling the epidermis, we lower its temperature and increase its impedance, which decrease electrical conductivity in the surface. Meanwhile, the dermis, where we actually want the energy, stay warmer and has low impedance, allowing better energy penetration. As a result, RF energy is directed away from the skin surface and moves more efficiently into the deeper layer, where collagen remodeling happens. Not only that, cooling is really important, not just to protecting the epidermis from burns, but also for reducing pain and ensuring that the energy is delivered exactly where it's most effective in the deeper layer of the skin. The advanced cooling system that the CELLINEW has offered is to customize cooling time for each patient and each treatment area. So when we do the treatment, we can adjust the cooling pulses to minimize the pain and improve clinical effects while making efficient use of the coolant. The system let us fine-tune the delivery time up to 30 milliseconds, and the amount of coolant matches the duration of each pulse. Plus, real-time monitoring by the device ensure the pressure and the coolant delivery always stay consistent, so the treatment is safe, stable, and comfortable for the patient. So the third one is the RF and the time or the repetition mode. So this one is actually I think my final why I choose this device, because I don't see yet at least any other device that has the fastest repetition mode in the market right now. So this actually highlight how faster the repetition mode in this graph actually showing the how fast the repetition mode and how they can improve the result and save time for us as a practitioner and also much comfortable for the patient. So when the RF shot when RF shots are delivered at the shorter interval, heat loss is minimized and heat builds up more even effectively in the skin, leading to better treatment outcomes. So this one is an advantage for the patient and for the practitioner. We can have a shorter time for the treatment and make it like quicker for the procedure itself. So it's good for us as a doctor. In CELLINEW, the repetition modes that they offered is 0.1 second interval. So they stated that in 900 shot, we can treat maybe 30 minutes treatment duration time. But for me, maybe a little bit longer. But it's not like 1.5 hour, and yeah, it's really changed our my practice actually comparing using the longer interval time. So I don't need to explain more about this one. So I think it's already explained back then. So what is really important for me, or what to expect for me when I choose an MRF device, I already mentioned. One, it's a good thing if we can have something that can adjust it in every patient's skin, like a personalized treatment. When we have an auto fit technology here, they can change the energy that is delivered based on the impedance itself, and then we can control or adjust the cooling itself for a better treatment for better treatment experience, and also the repetition time that is the fastest in the market right now. Not only that, the CELLINEW, of course, this one is categorized as a new device. They still doing their clinical study, but this one is the preclinical study that they've been done. It showed that on the left side here, you can see that after the treatment with the CELLINEW, you can see that after the 30 days, the tissue has thicker and denser collagen bundles, meaning improved skin laxity and also structure. On the right side here, the image showed that how control thermal energy activate fibroblasts and remodels the extracellular matrix, leading to a new collagen production and a lasting remodeling. Overall, this changing explain how RF treatment enhance skin firmness and regeneration at the cellular level. And this one is on the a comparison between two devices that been done. It showed that in the preclinical test, comparing two monopolar RF devices, where the CELLINEW devices demonstrated that an average collagen increase of 26.2 here, and in some cases up to 31.6%, while a comparable device achieved only 21%. On the right side, you can see the histology image show that the dermis thickness improved by 20% by using CELLINEW device, almost twice the improvement of the other device, which averaged 10.4%. This result highlight that CELLINEW is more effective at stimulating collagen production and increasing dermal thickness for better skin rejuvenation and, of course, skin tightening effect itself. Okay, this one is my clinical experience. So I'm sorry that I need to cover the eyes of my patient because they don't agree to be shown everything. But what I want to I want to show you here is the improvement of the lower face. You can see there is improvement here on the term of on the make the skin even slimmer on the lower face. And also you can see the smoothness on the superficial skin. And the patient also said that there is improvement also on the pore size here. This one is the second patient. You can see also it's more V shape on the patient lower face. They have the same what I can say saying the same thing. There is a improvement of the lower. They said that the lower face is more tidy. They said, how can explain that it's more fish-shaped, maybe what they means. And then also the improvement of the pores and they smoothen the surface of the skin. The same case here. They have a better V shape, and also a better of uh, pore reduction here. Not only the lower face that is there is improvement, but also on the neck and decollete area. You can see here there is an improvement on the lines on the decollete and the neck. Also, I did this one for the patient on the improvement of the wrinkle around the periorbital area. So as a conclusion, MRF remains a top choice for non-invasive skin tightening due to its effectiveness, and it can penetrate deep into the dermal layer, even deeper than the dermal layer, with the minimal downtime. The selection of MRF device should consider not only safety and efficacy, but also treatment speed and patient comfort. Key technical factors such as impedance control, cooling mechanism, repetition rate directly impact the treatment outcome. Devices featuring out-of-field energy matching, adjustable epidermal cooling, and high-speed repetition provide superior performance. And this advanced feature contribute to a tolerable, fast, safe, and highly effective skin tightening experience. Thank you for your attention.